I'm going to pass over to Doron even before I introduce Aviad. So Doron, over to you, and Shana Tova, everybody. And
last week, that 800 cases in serious condition was the maximum that the system could effectively handle.
Daraba. Thank you, Teddy, and Shana Tova to everybody. Gamar Tov. It's wonderful to have you with us this evening. And a big thank you to Teddy and to Aviva. Teddy is the chairman of the Telfed Aliyah Projects Committee. Aviva is our staff member. He's in charge of volunteerism, events, and community projects. And I want to thank the two of them for helping to put together another wonderful evening together with, and thank Aviad. We're really looking forward to hearing your words of wisdom.
Oh, okay.
I'd like to open with just a few words about the organization behind this evening, and that is Telfed. And sure, most of you know about the organization, but just a quick recap, and we can say thank you to Telfed for bringing us together this evening. The Telfed was founded in 1948 with the establishment of the State of Israel. We were founded to look after the 800 Machal soldiers who came to fight in the War of Independence and help the newly formed IDF. And those 800 Machalnikim from Southern Africa made a huge impact on the IDF, helping to set up the Air Force, the Navy, and many of the ground forces. And since 1948 until today, we've been looking after Southern African Olim. Today, we also look after the Australian Olim, and we've now started with our regional volunteers in conjunction with the Hitachtut Olei Britannia to also help with the Klita of British Olim. And we have Arnie on here this evening as well, and please God, soon Arnie will be welcoming those Olim at the
few days.
So I'd like to just relate to some of the services that Telfed provides. We have a full-time Klita advisor that deals with Aliyah advice, both pre-Aliyah, after the person arrives and has been met at the airport by Arnie, and Ad Me'avesrim, whatever is needed for their absorption. And Telfed deals with Olim, their children and their grandchildren, so 3 generations down the line. We have a full-time social worker who assists people that are going through difficult times and are having a tough time with their absorption. And Telfed supports 450 needy Olim every month. That's to a rate of 2.5 million shekels a year in financial aid. And that's all dealt with by our social worker and her committee, the assistance committee of volunteers. We also have a full-time employment advisor and a career counselor. They're both the life coaches to help people with their entree into the employment market. Obviously, a big worry of people when they make Aliyah is how to find a job. So they're dealing with pre-Aliyah and post-Aliyah. Telfed gives over 500 scholarships every year to students. So if you, your children or your grandchildren, if they're studying, make sure that they're on the Telfed database so they can apply for those Telfed scholarships. It's another 2.5 million shekels a year in scholarships that we give out. And one of those projects is the PRUS program. The PRUS program is our students do 3 hours of community service every week. So if you would like a student to assist you, well, now's the time to apply. It's only till the end of September, so that you're able to apply for a PRUS student to come and help you for 3 hours a week. It's a university student. So go onto the Telfed website. I wrote it in the chat, and you can apply for a PRUS student to come help you, and that's till the end of this month of September. Telfed is the only organization that provides housing for Olim, and that housing is rental housing, subsidized rentals, that is that's given on the market in Tel Aviv and in Ra'anana at up to 30% below market rates. So that's a very big help for the Olim. Events like we're having this evening, Telfed has over 90 events a year. Now they've all moved to a virtual platform with about 5,000 participants in our events. And thank you for being part of this virtual community. And once again, thank you to Teddy and to Aviva. And the last point is regarding our volunteerism. As I said, Aviva is also in charge of volunteerism. So if you'd like to join our group of volunteers, welcoming Olim, assisting Olim, whatever it is that you'd like to do to help our community, please drop a line to Aviva and she'll be happy to inform you about the different volunteer choices that are available. And my last point, which I'd like to finish off, is that Telford has received 2 government awards for excellence. You would assume if we receive a government award for excellence that the government would help us financially. Actually, the government accounts for 1% of Telford's budget. And 99% of our budget, of our 9 million shekel budget, we're responsible for ourselves. So if you would like to make a donation, a New Year's donation for Rosh Hashanah, Yom Kippur, if you'd like to help Olim, I recommend and encourage you to go onto the Telford website. They're beautiful cards that you can dedicate in honor, in memory of somebody. And please make a donation on the Telford website to enable us to continue with the wonderful work that we do in assisting our community. So Toda Rabah, have a wonderful evening together with Aviad. And thank you, Aviad, for sharing your knowledge with us. And I want to wish everybody a healthy new year. Toda Rabah.
Thank you very much, Doron. By the way, a great Hamsa collection on the wall behind you. All right.
For that, I must thank my wife.
All right. Okay, so let's begin.
Wait a second, Aviad. Before you begin, I have some sweet words to say about you. So again, welcome. How are you doing? Nice to see you here. So for those of you who don't know, Aviad was born and raised in Rishon LeZion, and from a very young age, liked to care for other people. After graduating from high school, he enlisted in the IDF, where Aviad was first exposed to the studies in the medical field, training as a combat medical in the Arms Corps. He went on to serve as a senior paramedic in the clinics on the base, where, as well as accompanying the soldiers on various operations. After his military service, Aviad turned to the field of natural medicine. He completed his academic studies at the Raymond College in Israel, the leading education institute in the field of alternative medicine. Aviad's studies covered training in various fields of treatment and diagnosis, including natural nutrition, reflexology, aromatherapy, Bach flowers, medicine herbs, nutritional supplements, ideology, and more. After completing his academic studies, Aviad opened a private clinic and also receives patients at the Maccabi and Mu'chedet health funds. Today, Aviad runs a successful private clinic and works in alternative medicine at all the health funds, lectures on natural medicine, as well as trains new therapists. Aviad, over to you. And before you came on, I heard people saying among themselves that I take 35 pills, I take 40 pills, but let's hear from you. Help, I need your help. Thank you for being with us this evening.
Okay, thank you very much, Teddy. So we begin.
Just before you do begin, I wanted to just remind everybody, for best enjoyment, if you put your Zoom on speaker view, you'll be able to absorb the whole.
Okay, 1 minute. Okay. All right. Hello, everybody. Like Teddy said already, my name is Aviad Zohar. I'm a naturopath and reflexologist. I live in Rishon LeZion, married to my lovely wife, Oshrit, and with 3 wonderful kids. I am a Reedman College Complementary Medicine graduator. I have a clinical experiment with a patient for 13 years already. I used to lecture at Redmond College as well, and I used to consult for nutritional supplements at Clalit HMO. Currently, I run my own private clinic of natural medicine and work at the Maccabi and Meuchedet HMOs, like that is said already. Okay, so it is my first lecture in English ever. So please be patient with me. Thank you. Natural medicine, help me, please. Today, I want to show you an additional way, a wonderful, natural way to deal with physical and mental problems. This is more natural and friendly, and I hope that after my lecture, you'll be able to make better health choices to you and to your family. Okay, so the topic on today's lecture. The first one is holistic natural medicine. We'll see the connection. Second one, it's history and culture. The history of natural medicine is actually traditional medicine. Nutrition, that is a huge part in naturopathic way and generally natural medicine. We'll talk about it also. Medical herbs are the foundation of medication and medicine. Supplements. Supplement complete our nutrition. I'll tell you about some common supplements and we'll understand this issue. Integrative medicine. What does it mean? Important researchers to understand better natural medicine. And finally, I shall give some golden tips for the corona times. So let's start. Natural, it's actually holistic. It's the same thing. Natural medicine is basically a holistic medicine that combines the body and the mind in diagnosis and treatments. This approach is contrary to conventional medicine approach that advocate treating the disease and not the person like the natural medicine do. Natural medicine refer to the following factors as well: the person's lifestyle, mental and emotional difficulties, past and present effect, and much, much more things that we see when we see the person and not only his illness or the problem he come to the clinic with. All right, history. It's talk about traditional medicines. Generally, from the dawn of time, medicine has been here. Since the biblical times, people have always wanted to treat disease and their dysfunctions. Long before the modern medicine, as we know it today, many different types of medicine were developed around the world due to culture or religions, depending on the area where it developed. Despite their differences, they all had common ground. One is the holism, the whole, to see the person, body, soul, mind. And the second one, it's their lifestyle. Every place adapt a unique lifestyle to stay away from diseases. And like this, those people learn how to heal themselves and the people around them. And most of these historical and traditional medicines are still with us today and rise in the recent years. Four of these leading traditional medicines are the Chinese medicine, the Japanese medicine, the Ayurveda, it's the Indian medicine, and of course, the Jewish medicine. Today, I'm going to focus about two of these, the Chinese medicine and the Jewish medicine. So, let's start with China. The Chinese medicine is based on two main theories. The first one is the five element theory, the one on the right side, that including the elements fire, earth, metal, water, and wood. And the second one is the yin and yang theory, the one on the left. Probably most of you know this symbol, that combine the good and bad, the dark and light. And by those two theories, the Chinese doctor can see exactly what the problem and see how he can fix it, and to understand the function of the person much better. And to heal, the person will need to find a balance between those elements and yin and yang. The diagnostic tool in Chinese medicine is the first looking at the person, what not most of the doctors usually do, to look how he walk, how he looked, his color, maybe to see his face or look. Then Chinese doctors diagnosing by the tongue, by the pulse, and energy strips along the body that called meridians. The treatments would usually be done by adjusting a diet, a special diet, specific diet for each person and each problems, a Chinese herbs, of course, as well as a physical treatment like shiatsu, maybe tuina, and of course, acupuncture treatments are a main thing in Chinese medicine. Let's go back to our roots, the Judaism. So some of you might know this person. This person is the Rambam, Rabbi Moshe ben Maimon, who lives more than 800 years ago. He extensively studied the human physics and the healing principle of diseases, along with principle of Judaism and Torah, of course. So, although more than 800 years ago have passed, some of the things the Rambam said are still relevant to us today. And let's give some examples. The role of the doctor is not to heal the person, but to teach the person how to heal himself and give him hope and optimism. One of the big things that the Rambam talked about is give an optimism to see the next phase, and of course you see that the body can heal itself and the doctor just assists us to do it. Another thing the Rambam says, every disease also have a mental emotional root. Like we said already, this is the basic of natural medicines. Joy, it's the most powerful healing force in nature. Joy is good for every one of us. If you're happy, your body is happier. The balance of the mind consists of correcting the virtues and a good view of reality. We need to improve ourselves to get our body to be better. There is a great importance also to the quality of our sleeping, the air that we breathe, the water we drink, our hygiene, and sun exposure. These are all significant factors that affect one's health. The Rambam believes all the things that are around us help us to be better, and it's still on today. There are good recent study on sun exposure, for example, and how good it is for us from these past months even. And the last one is about nutrition. One of the Rambam famous phrase is, in the morning eat like a king, at noon like a prince, and in the evening eat like a poor. That means we also see today the importance of the breakfast, that it's still on nutrition, on diet. So the Rambam saw it many years before. So if we already talked about nutrition, so why it's so important to us? Nutrition is the base of naturopathic, and it's really important because nutrition is the fuel of our body. And if we want a good nutrition, we'll get a good fuel. Development and bodybuilding that never stop, not only in young age. Disease prevention. Many people come to naturopathic way because they know that food and nutrition, good nutrition, can help them to prevent and treat diseases, all kind of diseases. Body function. All of our organs and all of our body systems need good nutrition to get them better. Mental state balance, that really important, and also nutrition can help us with this. For example, if we take oatmeal have a great researchers to help clinical depression, so you can use it as well. Pleasure, we all need and should enjoy our food and have a good taste in our mouth, of course. And society, especially these times when holidays here, it's really important to enjoy the meal, enjoy the nutrition with everyone. It's a big part of our culture as well. So if we already talked about nutrition, I would like to give you some great tips, some basic rules of naturopathic and natural nutrition. The first one, of course, natural food. Natural food is the one that unprocessed. So if we take in any kind of food and do the less processed phases that we can, we probably will get a better food. So try to adapt it. As well, save your vitamins, your minerals and oils from your food. Don't cut it too much, don't boil it or burn it. Adapt the right food for you. Not all the people know exactly what's good for them. You can assist the professionals, but you should find exactly what's good for you, for your system. It's not the same nutrition to anyone, to everyone. Water and herbal tea infusions. Wait. Yeah, so water, it's really, really important to us. It's working to our whole body. It's like 60% of our body, it's water. And we need it for our joint, for our digest system, and to every organ we have. If we take some herbal tea, we'll get the water plus some activities, some medical activities, we can use them from the nature. Eating superfood of all kinds. There's a huge list of superfood that you can find, and most of them, every one of us could use it and will get our nutrition much, much better and to make us healthier. For example, green leaves, all kind of almonds, nuts, grains. You can use, for example, a chia seed, if you know this, and also spirulina algas and much, much more things. I recommend to consult with professionals, but still you can use most of those things and get your nutrition much, much better. And the last one that the Rambam also said, eating slowly and calmly, give a time to eat your food. We need the best absorption we can get, and that's the way to do it. So, next, we go into the plant size. It's a big, big problem when we see this picture here. Today, plants we take in doesn't look like regular plants from the garden. It's look like this, and this is the big question. It is a medicine or an herb. The first man made medicine was taken from nature. All descriptions and study on herbs were made according to the experiments and deep knowledge of the human body and mind. Today's herbs are usually found in extraction form, such like capsule, tincture it's alcoholic extract, syrups, and tea infusions. Therefore, the resemblance to drugs is greater. So if we come to choose a plant we want to use the professional way, first we need to know some things. The first one is to find the exact type of the plant. So if, for example, it's a kind of mint, there is like 4 or 5 kinds of mint, and you need to choose exactly the one you need. The relevant part, I'll show in the next slide, you'll see all the relevant parts we taken from herbs and plants. The location and the climate, we need to know exactly where these plants come from and how it grow up. The active ingredients is the most important thing on the plant, the specific ingredients that we want to use them for our benefit. And the form of extraction, like I said before, capsule, maybe tablets even, and tincture, and so on. After we choose the plant, we need to know exactly the medical activity we need to use to improve our health. I give you here some examples. There is the painkillers, antifungal, anti-allergy, sweaty, adaptogens, urines, anti-inflammatory, stimulated, carminative, that is fogging gas in the digestive system, anti-tussive, moisturizer, and much, much more. So if we find the exactly medical activity that we want, we can see great benefit for our patients. And so the plants part that we use is the roots or the flowers, for example, like in calendula herb. We can use the fruits, like in Sambuca nigra. You'll see some information about it on Corona slide. And the bulbs like onion, for example, seeds like fennel, the leaves like most of the plant we use, and the mint or urtica are a good example for it, and the stems. Okay, I brought you some common and main plants that we can use, and really important to know them. The first one, really famous one, the turmeric, the curcuma longa. So there is more than 3,000 studies in the recent year on curcum. It's a good, maybe the best anti-inflammatory, anti-cancer. Therefore, it will help us with osteoarthritis inflammation, osteoarthritis, inflammation of the muscles, for example, inflammation of bowel disease, and more inflammatory diseases. And we can, I think any one of us can enjoy the benefit of curcum. And I really recommend, of course, any supplement or any kind of herb use, consult a professional person. Next one, by the way, about curcum. Many people think that the spice is enough. Sorry to tell you, it's not enough at all. We needed the extract in much more than any other spice. So you can use it, but you cannot treat with this. Next one, also a spice, it's cinnamon, the famous cinnamon. Cinnamon help us to balance our blood sugar by adding it to our cells. It also warms and stimulates our blood circulation. It helps to improve appetite. I'm using it sometimes with anorexic. And it's a great natural calorie-free sweetener. So it's good for most of us. Just watch out cinnamon with people with high blood pressure. It can increase it. And the last one is chamomile. Chamomile is the best thing for our digestive system. It's relieve gas in digestive system. It's relieve heartburns, relax the digestive system muscles, and therefore good for abdominal pains and relax. One more good thing about them, it's also good for babies and small children. Okay, if we talk about herbs, let's go to supplements. Nutritional supplements is another field in natural medicine and maybe one of the main ones. Again, the question, tablets or capsules, is it natural? Unlike medications, the supplements are made from 100% natural materials, produced in a very detective production lines that belongs to a company with high standards. In, in our field, it's really important to find the exact company with the best standards. Here in Israel, it's much easier because we don't have too many. But you can find supplements all over the world, and you need to watch out what you get in and what you get to your body. The source of the supplement usually will be plants, like we already said. It containing the active substance plus the plant itself. It can be vitamins or minerals, the type that with the best absorption we can get. And a unique substance also that will find the substance in the exact dose according to the studies that we know. So, famous and popular supplements you probably all know. I'll say a few words about them. The first one is calcium. Calcium supplement, it's necessary for us all. Nutritional consumption is insufficient. We all need at least 1000 milligrams a day of calcium. In a good nutrition, you won't get probably more than 700. And if you're after postmenopausal women, so you need much, much more. It is important to our bone building and bone density. It's also good for our proper muscles care and of course the heart health. Another thing that's good to our heart and muscles as well is magnesium. That also very, very important to all of us. Here in Israel, we used to get 35% from our magnesium from our water. Today, our water is desalated, so we don't have any. So we all need some magnesium supplement. Also here, food and water are still not enough. Better studies are added every year. Magnesium good for all muscles and mostly the heart muscles. It helps in many body systems such as the digestive system, neurological system, orthopedic system, and even respiratory system. So I really recommend you all get magnesium, of course, with a proper consultant. The last one is omega-3 that is really famous in this field. The type of fat that called omega-3 just tell us the location of the chemistry bond. That's it, not more than this. But while omega-6 can be found in many foods, omega-3 is not. The balance between the two is necessary. Omega-3 thins the blood and it's a good anti-inflammatory. But omega-6 do just the opposites. So usually we'll need much more omega-3 because we're getting a lot of omega-6 from our food. Usually the researchers shows that we're getting like 20 times more omega-6 than 3. Then we need, most of us need supplements to balance these things between those two. All right. So after we talk about natural medicine and conventional medicine, the new thing is to combine those two and getting integrative medicine. And what it is? So it's a medical approach that does not preclude any method of treatment. It's assisted in medicines by testing and diagnosis. It's receiving additional therapeutic tools other than medication or surgeries. It's a way to thinking outside of the box. combination of body and soul and mind. Some of the doctors adopt this way, but not all of them yet. So if we take in a case study, for example, to understand it better, so a 45 years old man come to the clinic with a recurrent headache on his left side. We'll use the conventional medicine and do blood test, pupil test, anamnesis, blood pressure test, CT scan, and all those tests. And then we'll use the natural way and do a natural nutritional examination, emotional, mental questioning, examination of signs according to the particular diagnostic method, like reflexology, for example, or iridiologic. I do also in the clinic. And of course, looking at the patient and to understand him better. As a result, this combination will get into this conclusion. This guy probably have a constipation as a source of toxins due a fear he have. He also have deficiency of B12 and iron. He have some cervical pressure, increased caffeine consumption, and difficulties with his workplace. After we see all of this, we can treat this person much, much better. That's why integrative medicine can be the best thing for all of us. And this is the way we need to go to in the future. So I promised some researchers, I brought only two. One, it's about all wheat bread. That is really important. Not many people know the difference, but this is a good one. This is a review that included 45 studies from Europe, United States, and Asia, and that consumption of 90 grams per day of whole grains. It's like 3 servings. It was associated with reduction of 19% risk of coronary heart disease, 12% risk of stroke, 22% risk of cardiovascular disease, when the findings were similar both in morbidity and mortality. In addition, there was a 15% reduction in the risk of cancer mortality and 10 to 17 of mortality from any cause. When you see these researchers or a few research studies, you can understand that we can use this information for our benefit and not just to count on drugs. And you can take the risk off by nutrition. So this is a good example. The second research I brought, it's about a plant. Maybe some of you know it. It's called Altea officinalis, in Hebrew, netufit refuit. And I brought two studies. One is a Slovak one that found that polysaccharides isolated from the flowers have antitussive activity. It's cost reduction of number of cough attempts and instantly of a cough attack. And it was higher and better from the non-narcotic drug dropropazine. So you can use it as a great antitussive, and it's really friendly, this one. You can use it even without too much consulting. The second one is on the same plant. It's a British study that examined effect on the bacteria E. coli, that's really famous. The study found out then that tincture, alcoholic extract of the plant, has antibacterial activity up to 3 times higher than the control, a clean alcohol, ethanol. So you can use a specific plant also for antitussive, for coughs, and also for E. coli, that's really common. So this is the way to use it. Okay, our last part for today, it's about the Corona times. We all over the world, we're there. So what natural medicine has to say and how it can help us with this. First, protection. I really recommend, it's the best thing that we can do and try to do. Prevention is the forefront of solution. Alcoholic disinfect before and after contact, or washing your hand good, important. Stay in an open and ventilized place. This really important because most of the researchers I read, it's said that this is the best way to not getting infected. So we should use it with or without mask. Face mask, even if it's partial protection, I really recommend because this virus going infect through our respiratory system, and this is the way to deal with this. And like this lockdown, the insulation. I hope it will help us. Hope. So what we can do? There are some herbs that already researched on the corona or the corona symptoms. The first one is Sambuca nigra, Sambucos nigra, Sambuk shachor, the elderberry. The elderberry is the fruity that's really known for many, many years. And it's one of the best things for the upper respiratory system. It can help inflammation, it can help high fever, flu, even small cold, and especially treatment of cough. Also allowed for children and even babies. So this one you can buy anywhere. It's really, really good. You can see in every cough or every cold, great improvement, and it's even tasty. The next one is achinacea, the cornflower. One of the plants that improve our immune system function, especially during the illness and the disease, is antibacterial, antiviral, antifungal, anti-inflammatory, of course, and an anti-infective. So this one we'll use when we already sick, even on coronavirus. Of course, with professional help. And the last one, the main one, it's the matcha. You probably, some of you know, whoever doesn't know, so I'll explain. Matcha, it's the young leaf of the green tea. And it's really unique, really, you see many researchers, you see it all over around the kitchens everywhere. It's the color, it's really interesting. According to Dr. Gabriel Cousens, he's American physics and homeopath, the enzyme 3CL, the one that attacked our cell when we got infected with coronavirus, the materials in the matcha, the EGCG, antioxidant, and the quercetin can destroy that. So if we find a cure for corona, maybe it's not there yet, but it's we can see some research on it, and we of course can use it and maybe to heal ourselves from this. Additional plants that can help with corona, it's the flaxseed, the citrus peel, oregano, garlic, of course, ginger, and again turmeric, the curcum. Okay, it was wonderful to me. And thank you very much for listening. You have my details here if you have any question or something else, and you can have some question now.
Thank you, Aviad. There are some questions in the chat if you want to read them yourselves, otherwise we'll get somebody to read them. And in a few minutes, everybody's welcome to unmute themselves and ask you lots of questions. So let's first of all go to the chat. Do you want to?
Okay, I open the chat. Wait. Let's see. Okay, they said I sound very low. I hope.
I'll get to the last one. Somebody's asking about chemical sweeteners like saccharin. Are they bad for you? I guess they are. But...
Okay, like saccharin bad. So I've got a whole lecture about sweeteners, but it won't be now. Saccharin, it's not good for us because it can be toxic in some dose. I recommend some things, some sweeteners that much better. We have the stevia. Stevia, it's one of the best thing we have. Not everybody likes the taste of it, but it's really good for us because it's 0 calories, and it's have like a sweetness taste, but it doesn't increase our blood sugar at all. So this is a good one. And we have some things not here from outside of Israel. One is xylitol, the other one is erythritol. That's also good for us. Also we've got in Israel the, how it called? Wait, I remember. Okay, another one. It's called
Come
the
back to you.
diet. Sucra diet in Hebrew.
Ah,
Don't remember exactly the material now.
so
Okay.
somebody else asked a question if you can overdose from supplements.
Okay, of course, like everything, we have the exact dose and the right balance we need to get to. It's really depend on which supplement. There is some supplement you can take even 10 pills and nothing will happen. Nothing maybe not good and not bad. So you need to know exactly, and some of the supplement you take one more and it can be really danger for you. So you need to consult a professional person. And I really recommend to you all that members here now to send me maybe a WhatsApp or even give me a call to ask whatever specific question you have, and I might help you with this.
Okay, you have another question here. Somebody's asking about whole wheat bread. They want to know, they have allergies to whole wheat bread, so some
Allergies.
alternative.
Mhm. So we can, all of us can have allergies for almost everything. The whole wheat bread, it's mostly about the gluten allergy. It's not for the bread itself. If you have a gluten allergy that's called celiac, this is a different part and you cannot eat it. But most of us doesn't have an allergy for it. We just have some sensitivity for the gluten. And then it's not bad for us. Maybe in a specific ways like, I don't know how to say it in English, kusmin bread, it can be better for us. And in all wheat, it can be less. But still, it will be whole grains and we can use it in some other ways. If it's allergy and celiac, you cannot use this one. You need to find a different nutrition for you.
Usmin is spelt in English.
Spelt, that's
Spelt. Thank you, Doron, for the spelt.
Thank you very much.
Anyway, so guys, you're all welcome to unmute yourselves and ask Aviad a question directly. He's also offered to leave his contact details, and if somebody wants to send him an email or a WhatsApp and ask him a specific question. And again, thank you for giving of your time tonight and for giving us information and sharing tips and hints. I'm going to buy a bag of oatmeal.
Okay, great. Don't be depressed.
Okay. So, would anybody like to ask a question, just one by one? Louise, come on. Does anybody have a question?
Okay.
Okay, well, thank you so much, guys. Thank you so much for joining us. I want to remind you all that this is the first event of the new year. And during the month, there are some lovely events coming up. We have a lovely virtual tour to Haifa, and invite you all to join us to that and to any other event that you might like to. The events are already published on the Telfed website. Please go online and register. And we look forward to that. So thank you once again. your last chance to ask an important question about nutrition, about natural medicine.
Hello, I've got a question. My name is Stanley.
Hello, Stanley. Welcome.
Okay, I would like to know more about the quality control. If it's controlled, you know, like for medicines, they've got a strict quality control. In natural medicines, I have the impression sort of anything goes. Is this true, or is there some sort of testing done for them?
Okay, so I answer. That's right, because it's like a really gray field. You don't know exactly the type of the company. Any company can make supplements. That's why you need a professional person that knows some of the companies and their production line. And surprised, but a lot of medication companies have also supplements lines, and with all the lists and all the good production diplomas. So you need just to know exactly, but you can find great companies in these fields and see a lot of benefits with supplements.
Great, thank you for that. Does anybody else would like to ask a question? Otherwise, I'll thank you all for joining us and see you all next time.
Thank you. And Aviad, on behalf of Telfed, thank you so much for giving of your time and for the amazing, insightful talk.
Thank you very much. Shana Tova for us all.
Healthy year.
And to Aviva. All kavod.
Thank you. And Aviad, show your contact details once again if you like, and people will take a note. Otherwise, they're welcome to contact you through Aviva. Louise and Lily Rose.
Shana
guys.
Tova, everyone.
Everyone be well.
Thank you, guys.